Assalamu alaikum and welcome to Health is Wealth. There are about 10 million smokers in Great Britain, which accounts for about a sixth of the total UK population. 22% of males and 17% of females are smokers. And surveys have shown that 2/3 of current smokers would actually like to stop smoking. Today in the studio, I'd like to welcome Sunil Kochhar, consultant pharmacist for dearpharmacist.info. Welcome to the show, Sunil.
Thank you, Nadia.
So Sunil, why do people smoke?
People smoke for different reasons. It could be peer pressure. The other thing could be stress related, psychological. What's important to understand is that smoking is very addictive.
Yeah.
Nicotine within 10 seconds reaches your brain.
So when you are smoking, which is the most harmful ingredient in the smoke? Is it the nicotine or is it the other?
Yeah, as a pharmacist, we get that question asked a lot. Nicotine isn't really the most harmful within a cigarette. There are over 6,000 chemicals within a cigarette, and they're the harmful ones.
Right, okay. And do you know how many people smoke actually quit, or do you have any sort of statistics that you can share with us?
Well, the evidence has shown that people who have support therapy are, 4 times more likely to quit long term. Like you said earlier, that there are about 2/3 that want to quit. What happens is a lot of them don't know where to go to start the stop smoking program.
Right.
And the rest try and do it themselves, and that's why they're unsuccessful.
So with support of a healthcare professional, you're more likely to quit smoking?
You're 4 times more likely to quit.
4 times, and that's quite significant.
Yeah, that, a lot of people don't realise that, but until they start a program and they have that one-to-one support, they realise after sort of the 4 weeks they quit, that's when they realise the success.
So smoking, I mean, everyone says it's really bad for you. What kind of conditions does smoking actually give rise to?
Again, it's all those, we talked about the 6,000 chemicals within the cigarette. That's the bad effects. So you are smoking particles and chemicals into the lungs. Yeah? What happens then is you're reducing the amount of oxygen that's going around the body, and that creates a lot of damage in the organs. So respiratory is obviously the first kind of thing.
Of course, yeah. Asthma,
COPD, allergic reactions, coughs, wheezing, that's pretty much straight away. Then you have lack of oxygen, so you have damage to your cells.
Right.
What happens is your blood pressure rises, then you get cardiovascular risk. And it's surprising, about 100,000 deaths occur in the UK simply because of smoking related.
With cardiovascular disease?
Just in general, but 100,000 per year in the UK, and that's substantial.
That is very substantial. And not to mention the cancer
cancer
effect as well.
Yeah, so, throat cancer, lung cancer, and it also generates other cancers. So by quitting, you reduce your risk. So even by quitting within the first 24 hours, your breathing's better, your blood pressure goes down, your pulse goes down. Again, after a few weeks, your lungs clear up, you're breathing better, you're tasting better.
Yeah.
And then after a few years, you reduce your risk by half of cardiovascular. 10 years, reduce your risk by half of getting cancers.
Oh, that's
so there's, immediate sort of reason.
Benefit, yeah. And is it true also that your lungs go back to its original form after a set number of years as well, if you stop smoking?
Generally, adults are sort of under 30, they have more success with clearing the lungs.
Yeah.
But after smoking a certain amount of years, then damage has occurred, but you can help prolong your life. So statistics have shown sort of adults aged 35 or 40, for every year they've quit smoking, they live another 3 months longer.
Oh, wow.
So
clear benefits.
Clear benefits. And it doesn't matter how long you've been smoking, once you quit, you get the benefits straight away.
Oh, that's very, very reassuring. So how can a pharmacist help if someone wanted to stop smoking?
Well, pharmacists should be your first point of call.
Okay.
So you would go into the pharmacy, just talk about, to establish whether you're ready to quit. But there are several options as well. You've got telephone support. There's a charity called Quit.
Yeah.
And they do that in different languages as well.
Oh, brilliant.
So you've got your GP, you've got community nurses, and also healthcare trainers. But pharmacy is really the easiest point of call because we're on every high street.
And we're very accessible, aren't we?
And the hours that we open, people work. So we've got late nights, weekends opening, and you can adjust the program according to the person's need.
So what kind of nicotine replacement therapies are available?
So you've got nicotine replacements such as patches, chewing gum, sprays. You've got mints as well. You also have oral therapy, things like Champix and Zyban, so they're medication that you take orally. They work in different ways, but the support therapy speaks to the person as an individual, and then tailors it according to them. So you're twice as more likely to quit if you use a nicotine replacement of some sort, but alongside a support therapy weekly, you're 4 times more likely to quit.
So with the support therapy, does the patient then come and report back to the healthcare professional?
For example, in pharmacies, you'd meet weekly.
Right.
With support therapy over the phone, there'll be telephone conversations weekly. But it should be weekly, especially the first 4 weeks are the crucial part.
Right.
Because you can get some withdrawal if you're not using the nicotine replacement correctly. But meeting one-to-one, face-to-face weekly is more successful.
This is very important, because if you've stopped smoking and you've got the craving and you've taken, just say, some patches with you and it's not doing the job and you feel like having the cigarette, that interaction is important, because then you can tailor the medication, can't you?
So you have some tech support that can happen. Even ringing the pharmacy, in between that week. It doesn't mean that just because you've got a weekly appointment, you can't interact in between.
Of course.
So we have patients and clients that come in or just ring up, and we do telephone support. There's also a service where you can get group therapy. Now, the work and statistics done on group therapy is, again, that's even more successful than one-to-one.
So all this nicotine replacement sounds very costly. How much would it all cost? Is there a concession?
Well, when they're buying cigarettes, they're spending money. But however, the NHS have NHS programs where it's funded by the NHS. So if you don't pay for prescriptions, the support therapy and the nicotine replacement is all part of the NHS fee.
Oh, that's very good.
So, but if you do pay for prescriptions, then you just pay a prescription fee for each individual week supply for NRT.
Right, and how much is the prescription fee at the moment?
It's £8.20.
Okay, and that's a weekly thing then?
A weekly thing, with their nicotine replacement. But if they calculate how much they're saving when they've quit smoking, it overtakes what you are spending initially.
Of course, absolutely. So what is your advice for anybody watching who really wants to quit smoking and just needs that sort of push or guidance?
Well, if they want to quit and they feel they want to know more about quitting and the support therapy, go to your pharmacy. Have a word with a pharmacist. You can have private consultations with your pharmacist and they can go one-to-one, build an action plan for you. So it may not be immediately that you just quit. It may be to reduce the amount you quit and then eventually go to quit. So we call that harm reduction. Right.
And have you got anything else that you'd like to add for our viewers with regards to smoking cessation?
Well, because the program's based on Ramadan, it's an ideal opportunity, so where they are not smoking through the fasting period, is to use that opportunity to quit smoking. And again, once they've break their fast, then what happens is then they go straight to the cigarette. So instead, use some nicotine replacement. Take this opportunity during Ramadan.
That's very, very good advice. Thank you very much for joining us today, Sunil.
Thank you, Nadia.
So if you'd like to quit smoking, please do go and see your pharmacist for advice. Pharmacies are very accessible. They're there to help you. So please do visit them. We hope you enjoyed the show. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuhu. This year, the days of fasting are very long, and you're going to lose a lot of energy from not eating and not drinking. It can be very tempting to just stay home and do as little as possible to try and preserve your energy. It can be tempting to stay in bed or just sit and relax as much as possible. However, I'd suggest that you do not do that. It's important for you to stay active during Ramadan. The key here is to try and find as much low-impact exercises or activities that you can do during your fast that's going to keep you active and keep you energized. Walking is a great way to do this. Not only will it help you burn extra calories, it's going to energize you, and if you choose to walk after iftar, it's also going to help with your digestion. Now you can use many tools to help you stay active as possible in terms of walking. You can get pedometers. Pedometers are little things that you can clip onto your waistline in a belt or anywhere in your body where you can clip it onto, and it will count as many steps as you have walked during the day. The daily recommended guidance is to walk 10,000 steps every day.